Okay, now we have another question. The nurse obtains a prescription from a primary healthcare provider to restrain a client and instructs an assistive personnel to apply the safety device to the client. Which observation of unsafe application of the safety device would indicate the further instruction is required for the assistive personnel? We have four options. Placing a safety knot in the safety device straps, safely securing the safety device straps to the side rail, applying safety device straps that do not tighten when force applied against them, securing so that two fingers can slide easily between the safety device and the client's skin. So, what is the option that assistive personnel needs further instruction? And pause the video, guess the answer. The correct answer is number 2. Safely securing the safety device straps to the side rails. No, side rails in our policy it's not applicable. We have to put the restraint down, I mean from the down to side rails, and with the bed there is already space. We have to secure this restraint with that area, because in case of emergency it can cause injury. In case of CPR, in case of fire or any disaster, so with side rails it is really something, it can cause danger for the patient. And so kindly this is avoid the, I mean this thing that nurse should not apply, this assistive personnel should not apply the restraint with the side rails. Even it will be uneasy for the patient. Okay, that's why she need further instruction. Okay, so no need to read the rationale, we know already the answer. Okay, bye.